I'm filming now.
So first you're going to want to check that this kit belongs to the student, and you'll want to check if it has expired or not. Then you will want to perform hand hygiene. If a sink or hand sanitizer is not available nearby, it's okay to continue on. Next, you'll want to place some gloves on, and if gloves are not available, it is okay to continue on. You want to be careful while working with the needle because gloves do not protect you from a needle stick. Next, I'll open up the kit. So within the kit, there is a bottle or a vial of powdered glucagon, and this has an expiration date as well, so you'll want to check that before continuing on with the process. It also has a syringe full of diluting solution with a needle, and this is to reconstitute the glucagon. So the first step is to remove the plastic cap from the vial. If you have an alcohol swab available, you'll want to clean the top of the vial. If you do not have an alcohol swab available, it's okay to continue on. Next, you'll want to carefully pull off the cap of the needle straight up. And then you are going to want to insert the needle into the center of the rubber stopper on the vial. And you want to inject all of the solution into the vial. You want to keep the needle inserted so that you don't contaminate the needle. And then you want to swirl the solution so that it mixes. And you're going to want a clear water-like solution. If you cannot get this to become clear or water-like, you do not want to inject the student with the glucagon, and you'll want to stay with them and monitor them until the emergency response team comes. So you'll want to invert the bottle, and then you slowly want to remove all of the solution from the vial. And then you'll remove the needle. And then you want to tap the syringe and remove any large air bubbles. You don't have to worry about small air bubbles. Next, you'll select a site such as the back of the arm or the thigh. If the student is wearing thick jeans or thick pants, you may want to select the back of the arm. If you have an alcohol swab available, you'll want to clean the site. And again, if you don't have the alcohol swab available, it's okay to continue on. You'll want to insert the needle with a firm but steady motion. And then you want to make sure you inject all of the solution before withdrawing the needle. You'll then want to place the needle in a safe place, such as back in the kit. And then later on, you want to dispose of the kit in the correct container. If you have to travel with the kit to get to that container, you may want to tape it closed. And then you'll want to turn the student on their side because side effects of glucagon are nausea and vomiting, and you don't want the patient to choke. Glucagon is a fast-acting medication, and the patient should regain consciousness within 15 minutes. But during that time, you want to monitor their pulse and their breathing and look for any seizure activity.